So before they start the session, day before yesterday, Rajinikanth completed 50 years as a superstar in film industry. Our Ganesh Nayak sir has completed 50 years in one single company. He started his journey in 1977 from medical area manager, zonal manager, product manager, group manager, GM marketing, vice president, and today he is executive director and board member at the age of 70. And I am proud to say another 5 years he's got extension. I think he's the only person in pharma industry to achieve such a great feat. Hats off to you, sir.
Now, before we start this fireside chat, let me share some of my views. I am thoroughly impressed. Overwhelmed is a word with the use. First of all, I must thank Mr. Ramanathan as well as Mr. Sridhar. The way you spoke, very precisely, very concise. Not only did you use the growth or pathway to the next level entirely depends upon what scientific or commercial or business temper the promoters have. So our destiny is in a way in their hands. And I think to that extent I'm fortunate to have got into a company where the promoters, there was no nepotism, there was meritocracy, and there was a scientific temper, which is very important, because if you have to buy a machine worth 5 crore rupees, unless you have a science background behind you, you would not take that decision. You would say, why don't you buy another machine which is available for 3 crores or so? So I thought I must qualify these things here. Initially, Srivatsa told me that you give a talk. But I think with this AI, ChatGPT or Perplexity or Grok or whatever, I mean, you don't have to do anything. Any one of us, anyone, 150 people sitting here, you take one title and you put it in, you will get a full 5-6 pages story. Then you say, I don't know how to make a PowerPoint. It will make a PowerPoint and give it to you. So today, what I talk, you can equally well talk. The only thing will be, I have a label, worked for this company for so many years and this is my designation, etc. Otherwise, content will be the same. Delivery might differ depending on how well spoken you are. So that's why I said, I have stopped. First thing is I don't give talks outside. If you find other than the company's platforms, I don't engage myself in such platforms of talking to people or addressing people. Why? Maybe because I'm a reserved person or whatever reasons. But here, 2-3 things happened. And then I realized that there are many of the ex-Cadilians who would be present here. And then, of course, these two gentlemen, I've been meeting them for the last so many years. And him, of course, I met him last year in that IDMA program, Ramani. So then I said, I was on my way from Colombo back. So I told him, yes, I will. But today I'm so happy I took that decision. I was not very sure, how my experience would be. But even before 10% of the program is, or 20%, I must tell you that I am extremely glad that I took this decision of attending this session. So with that, so that's why I said, let's do a fireside chat, because it's more informal and, we can ask questions, we can smile, laugh, etc., have some pauses. Whereas if I'm talking with the PowerPoint presentation, and by the way, I don't like PowerPoint presentations. In all our annual conferences where I speak for 45 minutes with numbers, I have some 70-80 numbers to speak. But I don't use any slide, nothing. I just study my thing and just speak from my mind. Because speaking with this, you're looking at the slide, it doesn't work. So that's how this fireside chat has come to be. And my good fortune that I'm being engaged by a person who has more than 2 decades of exclusive experience in leadership and development, because today leadership and development is an important role. No? It's an overarching. You are the person or you are the persons who really guide the fortunes of the organization in training, developing mental makeup, etc. of people who grow in the organization and who deliver results. So thank you very much, and don't ask me too many tough questions.
Sir, precisely when we decided to have this session, I have asked more than 25 CEOs, pharma CEOs, and VPs of many pharma companies, asked them to send 3 questions. So I have received 66 questions. All the questions I have forwarded to him. And I have received 4 pertinent questions from Mr. C.H. S.V.R. Subbarao from USA. I told Mr. Ramakrishnan to incorporate those questions because those questions are very much addressing the budding entrepreneurs. So all the questions from the different CEOs of different companies. And he has shortlisted 10 questions. Yeah.
See, by and large, all the questions which you all will be asking me, I think most of us know the answers. Correct? Just that Ganesh Naik is here, so we have to ask him some questions. So we should. So please go ahead. I will entertain you. Correct?
Humility at its best.
Well, I mean, you heard, I don't remember that incident where he said in 1982, Swaminarayan means even I would have come there, not for the interview, but for joining. And I didn't have a house, that's why I was staying in that guest house, which all the medical reps and others used to stay. And I don't know how he dared at 5 o'clock to come to my room. And I'm so glad. I sincerely hope what he's saying is the truth. Correct? And, beg your pardon? Yeah, he told me that when I was coming here. I'm very happy because you see, this was not intentional. I was not a very senior person. I was just a deputy product manager, not even a product manager. And that was the first day of my joining, which was the 1st of January 1982. And I'm glad that, because these are things which are not intentionally planned or done. It must have just come. I took him to that Idli, Udupi restaurant, etc. Made him sleep in my room. Wow, can you imagine that? So other than my wife, I think he is the next most fortunate man.
Yeah.
So, see, there are some fundamental things which we need to practice. The rest of the things will depend running horses for courses, as they say. What is the size of your company, who are your promoters, what is your product portfolio, what are your aspirations, what is your funding, etc. All these things will matter. So there's no hard and fast answer to any business in the pharma business. And see, when I joined Cadila in 1977, the turnover was, I think, some 4 or 5 crore rupees. This year, you just heard, we'll be ending up with something like 25,000 crore rupees. Profits, etc., market cap, he has mentioned, that's all right. So I've seen the growth from the domestic to animal health, and I was part of the team which launched sugar free in 1988. Today, sugar free has a market share of 94%, the highest ever market share in any FMCG product. So animal health, consumer products, international business, the US market, the rest of the world, etc. So I've been very fortunate to see the journey. And there are so many things which I have learned. But by and large, there are certain fundamental basic principles one has to follow in life. Like hard work. There is no substitute for hard work. However smart you are, etc., etc., if you're not ready to work hard, you're not going to succeed. Likewise, there are these cardinal principles, etc., and finally, as business people, I'm sure you know it, entire thing depends on two things, no? Strategy and execution. Today, what has happened with so many consultants around, everybody, I don't know when I'll become a consultant, but with all my experience, I can share it with 50, 60 people. Forget this physical exchanges. If you go to the Google is gone now. Now it is all these 3 things which I mentioned, perplexity, grok and all that. You can get whatever you want. You ask a 10th standard intelligent boy, can you please prepare a document on a pharmaceutical strategy for India and rest of the world? Trust me, in 2 or 3 days, he will prepare a full document without knowing anything about the pharma industry, just getting material from the website or from the internet. So what has happened is strategy has become generic. What is the USP is the ability to execute, the execution or implementation. And implementation was a word actually introduced to us by Mr. Tarun Gupta. I think all of you know Mr. Gupta, correct? A great man. And he was a man who used to focus only on execution and implementation. If there's a strategy, etc., I will do. You just go and work in the field. And his other thing was back to the basics or stick to the basics. So there are certain things like this, cardinal principles, working hard, strategy, implementation, etc. If you follow that by and large and you have a company's support, you have a good team and you have a good leadership, then I think success will come. Rest of the things are all like writing a PhD thesis. So I'm a very simple man. I'm no PhD, correct? So, excuse me, so I thought I'll qualify before we start this. So half of your time I've already taken. Yeah.
So success comes before work only in dictionary.
We heard that before.
Okay. Thank you very much, sir, for that prelude. Yeah. And good evening, friends. Thank you at the outset, Srivatsan, for calling me. And during the introduction of Sri Nayak ji, there are some interesting, stories, one or two stories with your permission, one or two small short stories, because I am access or privy to one of his very close friends who worked with him in the field in Mangalore, in Karnataka, and he looks up to Mr. Nayak like the Himalaya mountains. He is a disciple, Mr. Prem Chandra Kamath.
Yeah, since you mentioned that and
Yeah.
he mentioned this, it was 1978. I was just 1 year old in Kedila.
Yeah.
And I had known him. He was working for Afali.
Yes.
I don't know whether that company exists today or not. And we were at the bus stand. So I met him, etc. And, I said, yeah, you're working in Afali. I heard there is a vacancy in Shimoga in Kedila. If you're interested, I can talk to the area manager. And he said, those days we didn't have mobile and all that. So next day he came to the the room which I was staying, and he said, I would be interested. And that's how it started, and then that's how he came. That's why he respects me a lot, because he says, my journey of some 25 years in Kedila is because of you.
So me and Mr. Kamath, we worked very closely together. Mr. Kamath was heading the Pharma division, and I was in charge. And our cabins were next door. So most of the coffee breaks, lunch breaks used to be together. And there hardly was any day in which he has not mentioned you, I should say, in 7 years. So almost every day. So one or two things I think we must appreciate and applaud is that when Cadila divided, there were two companies. One was with Pankaj Bhai, another was with Indravadan ji. And at that time, they were 16th, 17th position. And within 3 years, if my memory is right, with Mr. Ganesh Nayak and his team's work, the divided Zydus company, with whom the whole gang went with you, they became number 4. Within 3 years, they became number 4. This is a phenomenal feat, which is very difficult to replicate, I should say. And when I sit along with you, sir, we have a similarity in hairstyle. After that, the similarities fade because, yeah, no hairs but style. Yes. I am reminded of, sir, Isaac Newton. He said that I feel like I am sitting on the seaside looking for polished pebbles, but in front of me is an ocean with the depths I do not know, I neither can fathom. So I feel like that when I sit in front of you, right? And to ask you questions. I mean, that is one thing I practice, so I have to say it. So, in fact, your experience, expertise, track record, etc., goes before you. Like they say, the elephant comes and the bell rings in front of it, like that. I think we'll get right into the questions, with your permission, sir. Yeah. Like Srivatsan said, we had a bank of 60 questions, and then we had to sort it out and then categorize them all together. And then we selected just 10 questions of grave importance, which are burning questions, which I'm sure Sri Nayak ji would be able to enlighten us on his expertise and experience. So the first one would be, if you could erase one old belief about pharma sales and replace it with a new one, what would that be? Because we are all, a little old timers. We have a lot of beliefs about pharma selling, marketing, execution, etc. What would you like to replace one old belief with a new one?
Your old timers means what? You think I'm a young timer or something?
But you have evolved with time. You have evolved with time. Yeah.
One is beliefs, I don't think you can change. Maybe practices, you can. But anyway, let's not play on words. See, earlier, I would look at it as three phases. First is the phrase 50 years ago when I used to go to the field, most of us, the doctors would be waiting for us if it was a deep interior. Or even if it was a consultant in a place like Mangalore, where I worked most of the time, or parts of Karnataka, we used to go to the doctor. He was looking at your detailing capability, your persona, how you were dressed. Like today, Srivatsa was telling me, there's hardly any representative who wears a tie. And for us, thanks to Mr. Tarun Gupta, I don't remember a single day in the field. I worked in the field as a medical rep and field officer for hardly 2 years. Not a single day I had gone out without a tie. As you can see, even today, I make it a point to wear a tie. It is more out of respect for you. And that is what was told to us, that you wear a tie not for style. You're showing respect to the doctor. Just as I spoke of punctuality, if I have come with a tie here, it is out of my respect for all of you. So, speaking of belief, that first was you went to a doctor, you detailed, you gave some samples, and once in a while you gave a gift, was some small keychain or something like that. That went on for, I think, about 10 years, until about 40 years. Then about 35 years ago, this gratification started. It started with two companies. I think both those companies are in Ahmedabad, incidentally. Correct. And, the promoters had direct contacts with the doctors. Then this gratification started on smaller scales. Then it started getting institutionalized. Then it started getting replicated by other companies. And today, we are the ones who kind of initiated that. And now we say the doctors are demanding, the doctors are no good, doctors are this, etc. So that was the second phase. Now the third phase which has come, because awareness is coming up, and our government, the man sitting there, is hell-bent on cracking down. And then you have this UCP MP, all of you are aware. So things are changing now. The doctor who used to say, see, a stage had come. Can you imagine? There's a conference, gastro conference or whatever in Delhi, and I go to this doctor, I go to you, and I say, "Sir, doctor, your stay in Delhi, we will take care of." He says, "Which hotel?" So I say, "It's in Taj." He says, "No, yeah, this company has booked me in a 7-star hotel. So I will take this next time. Maybe this time you can take care of my air." Can you imagine that? I mean, what kind of respectful communication transaction is that? So now things are changing. Now the doctor says, "Hey, hold it here. Passport, income tax is there. You see my stamp. Then he will ask me from where you got this money. And the moment I say it is from this company, then the NMC will come into the picture. They will talk about cancelling my license. Income tax will pay." So he says, "Yeah, no, I have to be careful." Of course, we are finding ways around it and all that. But this is the third phase. So the belief, which was very simple, if you call it a belief, that I go to a doctor, detail, he respects me, he writes my product on the basis of the quality of my product, the name of my product, and the interaction on the basis of that. That practice has changed now.
Very interesting. Yeah, next one is another burning question, where we trainers come in, acquisition of talent and retention of talent. So most of the people who are operating companies, who are running pharmaceutical companies, I deal with some regional companies. We have a huge problem of acquisition as well as retention of talent. So this question is, how can we attract superior talent to pharma field selling positions, starting at base level of MRs? Attracting and retaining talent at this level has become a burning issue. So what would be your guidelines to attract best talent and also to retain best talents?
Do a havan and pray to God. I'll tell you, it is such a challenge. 25% is the attrition big companies like us have. And I was talking to Srivatsa this morning. I come from a family of doctors, including my daughters-in-law. And I have direct feedback, not that, survey. In the survey, when people conduct surveys, my answers depend on my mood at that time. Second is, what was my problem with my wife this morning? On the basis of that, my response changes. So these surveys are bogus. I'm giving you live survey, live feedback from my family members. They say, look at the company. If it is a good company, that is one. Second is, if the product has some distinction or some innovation. And the third is, the most important, regularity of the representative. Now, if we have 25% attrition, now you are Dr. Ramakrishna, correct? Yes. And I'm a rep. I come to you, I've been working for 5 years and then you're writing my product, etc. Let's say esomeprazole you're writing. You have 4 other companies, Torrent, Sun, Intas, Cipla, who also have esomeprazole and they are also pestering you. But you have to share this and you're writing my product because 5 years I've been here. Now suddenly I change and another rep comes. So what happens? You are relieved. You are relieved because now this one product I don't have to write. So, and see, if I know you for 5 years, I can say, "Alright, sir, you have stopped writing my product." Now this new man cannot. And he already has those 4 companies breathing down his neck. So he keeps quiet. He says, yeah, okay, he doesn't write. It'll take that new rep 3-4 visits before he becomes familiar. Now by that time, with this 25% attrition, the next rep also has left. So what will happen? Over a period of 1 year or 2 years, that brand of mine, which was esomeprazole, which was well established, suddenly loses its complete base. So attrition is a challenge. There's no doubt about it. And I gave you the impact also of attrition. It is not such an Now, what is the biggest problem? We don't get good reps now. I have worked in the field. I make it a point to work in the field wherever I go in the world, at least until about 3-4 years ago. And I was working in Mumbai and we were going to a consultant. When I saw this rep, he was from Bihar. And then I asked him, etc. There were 4 or 5 reps from Bihar. They were staying in a room in somewhere near Thane or somewhere. And honestly, I was feeling bad to visit the doctor with him. See, a medical rep's job is a very, very challenging job. And I can say it with full conviction because I have worked and I have gone through bad phases also, how doctors have misbehaved with me. Now, that was 50 years ago. Today, people, even youngsters, they have aspirations. They need a quick fix. And they know about this job. And I'll give you a good example. This was about 8, 9, 10 years ago. We work with McKinsey, Bain, BCG and Accenture. So in our boardroom, we were sitting, including Pankaj Bhai, myself, and our seniors were there. And these 4 people from McKinsey were there. And the subject we had given them was attrition. So their India managing director said, we have to pay people well, we have to train, develop them, and that is how we should get good reps. So I'll not take his name. I said, listen, hold it. I said, we have some 20 people sitting here, correct? I have a simple question to ask. How many of us would like our sons to become medical reps? Raise your hand. Not one raised there. I'm glad that you have raised it. Not one raised his or her hand. We want to be our children to become doctors or engineers or chartered accountants or this. So first is that demand and supply, which was not such a challenge in the yesteryears, today has become a big challenge. And when supply is not commensurate with the demand, there is bound to be dilution of quality. So now you might say, you're telling me the problem. I have asked you for a solution. The solution is whatever resources you have, you should come into the picture. You means training, development, and if you can have a clear career path, that is easier said than done. Career path means you can't just fool somebody, no? You'll have to have a proper documented thing, you'll have to have some experience, etc. So, short answer to a tough question is, it's not easy, but there are several ways. One is monetary, your incentive. See, earlier, our incentive package used to be 65 was salary, 35 was incentive. Now, I was talking to one of our businesses and I was pleasantly surprised. He said 60% is salary, 40% is salary, 60% is incentive, which in a way is good. But then incentive also is tricky. You must earn the incentive, no? You might say, I will give $1 million, but which you will never get. So anyway, it has to be handled. It depends on the company, training, development, right recruitment, and creating a good environment. And I give you the example of my area manager made me change my life. So you must have good managers. Today I find there are so many anonymous letters come, from representatives that my area manager has done this, etc. So, Okay, next.
Okay, I understand that, sir, because I remember way back, when I was in Ahmedabad, 1 year, our field force was 600 and we trained 1,000 people. And that story is, I think, similar to many companies, if not more. So that kind of attrition is very difficult to handle. And ultimately, people come back and they ask us, what kind of training are you giving so people are leaving? So it is a very tough chicken or egg question. And we need to have a series of strategies to retain them, as you said. With so many restrictions and less face time with doctors these days, what are some of the creative ways your sales team stays connected and makes them an impact? We are basically, asking in your present assignment, how are you differentially making the representatives gain that window of time? Because time is shrinking in the cabin. Is there anything to be learned from your present day experience to make this interface with the doctors last a little more and more impactful?
See, I think all the top companies have now started using digital technology.
Yeah.
Like, you showed the bag.
Yeah.
The bag is gone.
Yeah.
Correct? Now either you carry a small briefcase or you just carry the iPad and you use technology. So in terms of engagement of doctor, it has become a challenge, no doubt about it. Now in that short limited time, what you can do is also this. So that which was 90% or so has now become 10%. Remaining 90% is you also have to focus on patient centricity. Means you have to tell the doctor that this is what I'm going to do to your patient. And through that, you have to keep your engagement with the doctor. Just trying to detail to him, sending, I was also on the board of Bayer. We had a joint venture which closed down last year. I mean, they had such high technology, German technology, where, you send a mail to the doctor. The moment he opens it, you come to know whether he has opened it or not. So if you have sent 100 mails to a doctor, if he has not opened it, you will know that he has not opened it. So there are emails, there are WhatsApp, but you must understand there is a limit also, no? That the moment you irritate the doctor, like they say in Hindi, lene ke dene pad jayenge. I mean, you're not getting, you will be losing. So, but technology is to be used. Just WhatsApp, email, etc. is gone. Like you say, everybody talks about Gen Z. But Gen Z, now it is Gen Alpha. These 10, 14, 15-year-old guys are absolutely this. We should be worried about the next generation, which is Gen Alpha. Gen Z is past. So now you have to bring the patient in. And there are some very good programs. In fact, we have one program. I wanted to test it. So I told them, don't tell them my name. And it's a 3-month program. You have a psychologist, you have a doctor, you have a nutritionist. And they measure your days, whether how many you have drunk, days you have drunk, what pegs you have drunk, what is your nutrition, etc. I mean, I'm a part of the medical fraternity, pharmaceutical fraternity. If I was impressed, I was just thinking, if the doctor is made to realize this, that his patients can benefit through this, I mean, that will be a very good way to engage doctors. So you have to find out new methods to engage with the doctor. That thing of detailing and talking and communication, giving knowledge sharing, etc. is there, but it won't yield outstanding results.
Thank you, because that impact is becoming less and less.
Yeah, and
as you were
today
saying,
everybody
yeah.
talks about patient centricity.
Yeah.
It has become a kind of cliche.
Yeah, next one is the ethical question, which you already connected, which already said a few words. Ethics has become a hang fire, and with unethical transactional practices going on around in pharmaceutical market, how can we survive with an ethical only approach? And you see PMP curb restrictions hanging again like a sword of Damocles. How do we operate in this unethical market? Is it possible to market at all with ethics only, or do you recommend a combination?
See, I'll be talking a little bit too high, correct? Which I'm not personally happy, but you have to have innovative products. Your ethics has to come right from the top. They say culture. What is culture? Behavior at scale is culture. In our company, punctuality is there, but it is at scale, and that is our culture. So ethics also cannot be that, we only tell at the lower level. It should come right from the top. But then you might say competition, if they do this, what will I do? For that, you have to have products which are innovative, and you have to be ready to bear a temporary setback. Because see, there are some top companies which are so well entrenched, it will be very difficult for you to displace them. So these malpractices or unethical practices, whatever you choose to call them, they will exist. But as I said, the government is very, very keen. Now, the biggest challenge, I hope you have that question there, is generics. Like today when I go to the US, etc., out of a 3 billion, this year, January, December, US business will be $1.3 billion. It is all generic. And how it is transactional. Metformin, there are 3 top buyers in the US, correct? So every 3 months they float a contract. So Intas, Cadila, and let's say Cipla, we sell it at $10 a bottle, and they bid. If Intas gives it at $8, gone. My whole $200 million business becomes zero overnight. So likewise here in generics, we already have a taste of it. I think some 7-8% of the 2,40,000 crores is generics. And what happens, and today generics is not officially allowed, but still it happens. The moment it becomes official, legal tender, then what will happen? You will write my Oxalgin, and that chemist will say, no, this you take this. The patient will say, no, Oxalgin is, he'll say, no, that is 10 rupees, I'm giving it 8 rupees. So if you ask me, the domestic business is fraught with a lot of challenges, and people will have to be on their toes.
So the future is hot waters. We'll have to swim with
Hot,
great care.
You call it hot, warm, steam, whatever.
Yeah. Like you mentioned, sir, digital health, AI and data analytics are transforming healthcare. What are the most impactful digital innovations you would recommend to medium scale, small scale, or marketers, pharmaceutical marketers? Because the top layer has entrenched digital platforms in place. Which is capital intensive, very expensive to implement. And there are medium level and lower level regional players. So what kind of digital innovations would you like them, or would you recommend to them to survive in a shark infested water like this?
See, actually, there's so much of evolution which has taken place in the field of digital. There's digitization and then digitalization. Digitization is you have all your data computerized. Digitalization is then you use expertise how to use that digital data. So I think the first thing is, like it came with the chemist, no? It's only in the last, I would say, 1 year that at least, I don't know, percentage, 60-70% of the chemists now have computers in their this, and they use software. Earlier it was not there. So with GST too. But now my immediate thing would be all medium-sized, small, first you must get your data digitized. You must have everything on that computer platform. And once you have that, there are so many, because as you said, it's capital intensive. Like we have embarked on a 3-year program with one of the top consultants, and we are paying absolute top dollar.
So again, that is a challenge for small scale companies, but you are saying that they must digitize.
Yeah, digitize and then find out. There are
convert all of them into
softwares, opportunities.
Knowledge management database kind of a thing. Yeah, this is a very interesting question, sir. I think your experience would be a big guide here, and your vision, a little bit of crystal ball gazing, if I may. What digital behavior will differentiate tomorrow's successful medical representatives? What would an ideal MR of the future look like in the next 5 to 10 years? So that we can start preparing them for the future. If we know that this is going to be the evolution, this is going to be the direction, this is going to be the road map. This is a kind of a representative I must have 5 to 10 years in order to survive in the industry. What could you, if you could gaze and then give a general idea of what will be the future MR look like?
Look like means physically or?
I mean, knowledge, competence-wise, knowledge.
Physically, he already told you that the ties have gone.
Physically well equipped, knowledge as well as
I don't know whether they wear jeans and all that. Maybe last will be shorts.
Knowledge and skills, sir.
Shorts.
Knowledge and skills.
I got it. That was a little lighter way. See, you are a training and development expert. The first thing is, the moment the representative comes for training, the first day itself, it should start with the understanding of digital technology. for him, he should realize that paper and pen is dead. So that induction at an early stage of his career is most important. Second is you should have a constant, doctors you can't bombard, but your field force should constantly be exposed to different modules of knowledge, and not just exposed, you should also have, well, of course, earlier we had a lot of challenges from unions, etc., FMRA and NFSRU and all that. Today it's almost non-existent. So you should get them to attend, conduct tests on a weekly basis. So if you ask me, the rep of the future has to be a knowledge person, ably assisted by technology.
Thank you very much. That is a reassuring answer for training and development professionals, because our role becomes all the more important. It is, and then it will be.
It also makes your job tough. No, you have to understand technology in this.
We have to relearn the basics. Yeah, you're right. That's a challenge for us and the training professionals. They themselves have to be adapted to it. Yeah. Next question is basically from, I remember this question. It is from Mr. S.P. Maitra, who was my boss in Intas. And his is a broader question regarding the Chinese API, etc. But I will ask you anyway. How will the industry manage geopolitical supply chain and API, dependence risks, especially because of API and the government's PLI schemes, etc.? How can we leverage that? Is his question. He's very keen to get
100% API is not possible because China is far, far ahead.
Yeah.
Some amount of mitigation is possible, which has already started since last 3 years after the government introduced this production-linked incentive, PLI. And the government is encouraging it. It also depends on your scientists. Because why we have a problem? Because our R&D is not as well geared as the Chinese. And that's why our cost we can't match. One is scale and the other is technology. So the answer to that is, it's a process and we are on the right track, but we'll have to get onto the fast track of this API.
He would be very, very glad to hear this answer because he has a lot of challenges with API and costing. Yeah. Well, another point which you also touched upon is an important question from one of the seniors in the industry. As patient services relevant in near commoditized crowded brand segments like anti-diabetic, anti-hypertensive, anti-ischemic, etc., anti-asthma, etc., how much more relevant can we make the patient interfaces? Like you already mentioned that.
Yeah, you should have such modules where we can, like in our oncology, we have such a well-evolved and effective, like we have this Sigrima, which is pertuzumab. And any patient who's prescribed, the moment the doctor writes to the patient, our people take over. Okay. But there, of course, the product is 30,000, 40,000 rupees and all that, so that it can be afforded. But at a different level and scale, you should find out how you can, like asthma, if it is there, asthma is very complicated. So you have to find out how you can engage with patients. That's why that patient centricity is loosely used, but I think it is the thing of the future.
Yeah, I think Intas has a division for intranasal osteoporosis reduction, nasal spray. So the team takes over the minute he prescribes, they home, etc. I think that is probably what you are referring to. Yeah. Another is, sir, right down your alley about biosimilars. Most of us don't really understand. I mean, for myself, I have read about biosimilars only in the last 6 months or so. What is their importance? Because I have a client in Ahmedabad, Pharma. They are hugely into biosimilars now. So, what are biosimilars? Number one, and number two, what do you think is the future of biosimilars, and whether the regional players and small scalers can get into it, at least get into the gravy train, because it is going to take off like a rocket, is what I understand in terms of turnover.
First question is, the investment required, the technology required, the intellectual property rights challenges, etc. are so much, I don't think medium-sized, small-sized companies can get on the gravy train. What are biosimilars? Biosimilars are products which are not chemical entities. They are from living organisms, plants, and the like. Those are biologics. Biosimilars are copies of that. So that is the definition of this. MABs, monoclonal antibodies, is a subsect of biologics. To produce that, I mean, you know, in India, we have the largest number now. After Roche in terms of sales, DRL was there, we have overtaken DRL. We have 6 biologics, and we recently launched nivolumab, correct? And all these are, the originators have sales of 1200, 1300 crore rupees. And for us, each product is 150 crore rupees, correct? The generic. So to produce that, in terms of batch failures, in terms of clinical studies, in terms of the infrastructure, that machinery is mind-boggling. That's why I said for somebody to get into this in direct manufacturing is not possible. You can get into a tie-up if you have, like there's an Ahmedabad company which is strong in nephrology. So they came to us because we have this product, Desudistat. So you'll have to do something like that, but getting directly is a no-no. And biosimilars are the thing of the future. Well, I think you can Google and see it. In the top 10 products in the world, the total global market is about 1.1, 1.2 trillion now, correct? About 1100, 1200 billion dollars. Do you know what is the sale of the top 10 products globally? It is $150 billion, means 15% of the total sale of this is only from the top 10. In the top 10, 5 are biologics. And then there are products like there's a vaccine, and then there is a Pexiban, and then of course the number 2 and 3 are Ozempic and tirzepatide. What is it? Mounjaro, Zepbound, Ozempic, and Wegovy. So biologics, biosimilars are the things of the future.
Thank you very much, sir. I think we come to the last question. If you could give one message to the next generation of pharma professionals and leaders in India, what would that be?
Yeah,
What would be your recommendation for them to implement it? Because like the execution gap is a problem. Like you said, everybody can have ideas. Where the rubber hit the road is execution.
See, I don't know from where you got that. It said reliable, repeatable, and replicable. And now we are shifting gears from medical reps to senior professionals or entrepreneurs and senior managers or senior business people. See, for any good company, if it has to become global or even spread nationally, these 3 R's are very important. First, you have to make your performance reliable. Reliable with your stockists, doctors, chemists, etc. Which means you are following some right practices, principles, methods. Then you have to do it again and again. Second R, repeatable. And once it is done in one particular area, globally or national, your model should be so sound that it should be replicable. So if you can follow these 3 R's, if you can make your performance reliable, you can make it repeatable and replicable, you have a sound model in place which will also help you to go outside of the country or globally. The second point somebody asked me is, how you look the same as you are some years, etc. See, this is a general message, and I call it the 3 A's. This is a message for all human beings. The first is academics. You should have a fairly good education. My fundamental basic education is a BSc, that Harvard is okay, correct? But academics doesn't relate to that. Academics, that A means you have to keep on learning. You have to keep on learning. And now with your phone, you have, and with you have access to so much. But it doesn't mean that everybody does that. So the first A is academics. You have to be very strong in your knowledge base. The second is athletics. Athletics means, I'm not saying Olympics and all that. Your body. They say a healthy body harbors a healthy mind. And today, it's such a sad thing. So many people are just dropping dead. Either it's 45. My colleague Samir Desai, many must be knowing, 57. He died 2 months back. So you have to manage your body. You have to have an athletic position. And you don't have to go, I don't go to the gym and all that. I do everything at home. 70% is how much I eat. 30% is that exercise. Morning I walk some 45 minutes. Airports I keep on walking. So the second is athletic. You have to have your body in shape because otherwise you can't function. And the last one, A, is aesthetics. You have to have some style. Correct? If I'm coming here. So these 3 A's are very important, I think, for any person. Academics, knowledge. Second is athletics. Keep yourself physically fit. And third is have some style. Like, like you grow a beard like this up to here and all here. See style. So that
Becomes your brand identity.
okay. So broadly this is, and then you see there are some cardinal principles, like prudence, temperance, fortitude when things go bad, and finally justice. That people at senior level, you have to be very just. Like you see this example which he gave. I mean, I think it was a matter of justice. Somebody came and he didn't have a room, so I wanted to be fair to him. And that came from within. So you have to develop all these cardinal principles and values to be a good human being.
Thank you very much, sir. No wonder with all this, so-called true north principles which you imbibed, you are a role model to all of us. And thank you very much. It has been a great pleasure talking to you and sitting along with you, asking these questions and understanding some of the semantics and basics. Thank you very much.
Mr. Gopalan. Yeah. Come.
Both are humble as ever. I requested him to make a few words. He says, okay, Sridhar, anyway, you are talking more. Why should I speak? He says, please go. Yeah.
I request VVS money to come to the dais. Today we have assembled here. Because of only one person. It is VVS money. I forgot to tell this in the beginning. It is my mistake. With the open forum money. Apologize. And yes, sir, he has got a lot of questions for biosimilars. But now we are running short of time, sir.